access to after signing up. Also, if you want to follow me on Instagram or get a custom video over on Wizio, all of that information is in the description box. My Patreon information is also in the description box. Lastly, if you like this video, please subscribe and give this video a thumbs up. Now let's get into today's video. Hi, how are you feeling? A little nervous? It'll be okay. Yeah, don't worry. Don't worry, you're in great hands. Yes, Dr. Johnson is one of the best in the hospital. Probably shouldn't be saying that, but it's the truth, so don't worry at all. You are so taken care of. But if you don't mind, I'm just here to check your vitals, and also the front desk told me that they forgot to have you fill out some of the pre-op patient information. So I'm just going to run through that with you super quick, okay? And typically we have the patient fill it out, but you know, I don't want to overwhelm you, so if you don't mind, I'm just going to verbally read the paperwork out loud to you and get your responses. Just jot down your responses, okay? Perfect. Okay. So I've got my paperwork. And just get a pencil and we will get started. Okay, so obviously some of this information I already know the answers to, but just to keep everything proper and official, I'm just going to have you still give me your answers. And just answer each question to the best of your ability, as you would if you were home filling out this paperwork without me present. Okay? Okay. Name. And what is your date of birth? And what is your phone number? And is that a landline or cell phone? Okay. Jot down the same number for cell and your surgeon's name. Okay. And the date of your surgery, which is today. Roughly, what is your height and weight? Okay, and the anesthesiologist will come in and verify this information and is going to come in after me just to make sure everything is all set for your surgery. And what is your primary language? Will you be needing an interpreter? And do you have or have you ever had any of the following done? And if so, you're just going to give me a rough estimate of the date that you had any of these tests performed. So the first is a stress test. Okay. The next is a nuclear medicine heart scan, an EKG. And what date was that? Okay. Heart echo, Holter rhythm test, lung function test. And when was that? Okay, and then are there any other tests that you've had done that you think we would want to know about? Okay, perfect. Moving right along then. Okay, so in the past, have you ever seen any of the following doctors? So, primary care doctor. And what is your doctor's name? A heart specialist? And what is that doctor's name? A lung specialist? No. A nerve specialist? Any other specialists that we would want to know about? Okay. Okay, so this is also the medical release waiver. So if you can just sign your name where I X'd right there. Just sign your name. Thank you so much. Okay. Now, do you perform regular exercise at home? And how often? Okay. Okay. And do you take herbal medications or supplements or anything over the counter we should know about? Do you have any allergies? Okay. Any previous surgeries? Okay. And have you or any close family members ever had any type of negative reaction to anesthesia? No, anesthesia is very safe. I know. People, when going into surgery, it is the #1 thing we get asked about, and any type of negative reaction is extremely, extremely rare. It is very safe, safer than driving a car. Don't worry. Of course there are risks, but you know, the way I look at it and what I always remind patients is there are risks with everything, crossing the street, you know, it's just exactly. So try not to get too stressed out about that. If you are feeling very overwhelmed, stressed out, I did bring a sedative with me, and we do give that to patients who are feeling especially anxious before a procedure. Okay, well, you think about it. I have it there. It'll just be a little shot. I'll just give it to you, and it'll kick in, and it'll just make you feel kind of sleepy, drowsy. You won't be as nervous for the procedure anymore. Okay, so now I'm just going to go through, do you have or have you had any of the following? Okay, so the first is chest pain, heart attack, or other heart problems. Okay, the next one is heart irregularities or palpitations, high blood pressure, heart surgery or angioplasty, a heart pacemaker, an abnormal ECG, asthma or wheezing, lung problems or abnormal chest x-ray, seizures or epilepsy, chronic cough, stroke or intermittent numbness or blackouts, and do you take blood thinners? Okay. Frequent fainting or dizziness, do you smoke, and if so, how much? Do you drink alcohol? Okay, and how many drinks a week? Okay. Do you have a history of substance abuse? And if so, how long have you been in recovery? Okay. Is there any possibility of pregnancy? And when was your last menstrual period? Okay. Do you have difficulties opening your mouth or moving your neck? Just any? Okay. Do you have problems swallowing? Do you have any shortness of breath when walking or climbing stairs? Okay. Heartburn? Acid reflux? Any involuntary weight loss? Any fluctuation within 10 to 12 pounds in the past 6 months? Okay. Stomach ulcers? Skin sore or any open wound? Back trouble, fractures, or herniated disc? Diabetes? kidney, bladder, urination problems? What about liver problems? Hepatitis or positive HIV test? Arthritis? Thyroid problems? Any prior bleeding or clotting disorders? Severe snoring or sleep apnea? Do you have any chronic pain? Okay. And do you take any medications? Okay. What is the name of the medication? And what do you take that for? Okay. And what's the dosage? And how many times a day? Okay. Do you have any significant limitations, such as do you wear glasses, cane, crutches, walker, wheelchair, hearing aid? Any problems speaking? Do you need help dressing, help with meals, getting out of bed? Any spinal cord injuries or anything other? Okay, so just glasses. And will you accept a blood transfusion if needed? These are just questions that we have to ask you. There's no reason why you will need a blood transfusion, but you know. Okay. Okay. And do you have any serious illnesses that we've not mentioned? Okay. Okay, perfect. Perfect. And now I'm just going to need you to sign and that you attest that the above information is correct and is answered to the best of your knowledge. So I'll just need you to sign and print your name, okay? And then just check off that the form was completed by, it gives the option of either patient or family member. So since we did it together, you'll just check off patient, okay? So just sign here and write your name. And just check off patient. Perfect. Okay, great. Okay, so I'm gonna give that to the doctor, hand that over, and they'll take a look at it before we begin your surgery. But you should be all set. Now I'm just gonna have a quick listen to your heart, lungs, and listen to your blood pressure. And then the anesthesiologist will be in, ask you a few questions. Before I leave, I can give you that injection to calm your nerves if you're interested, okay? It's completely understandable. Everyone gets a little nervous before surgery, but just know that this procedure is extremely safe. You really don't have anything to worry about, and it'll be over before you know it. You shouldn't be under for more than an hour. You're going to feel tired, and next thing you know, you're going to be waking up in the recovery wing. Okay, but let me listen to your heart. Okay. Deep breath in and out. Deep breath in and out. I'm just going to listen to your heart. Very strong. Okay. One more big breath in for me. And out. Everything sounds great. Everything sounds perfect. Okay. So the next thing is just your blood pressure. Just roll up your sleeve if you could for me. And I'm just going to put this around your arm. Okay. Now around. There you go. And we'll just start. Thank you. Yeah, you can just lean your arm there. And just make sure your legs are uncrossed, please. Okay, good. Okay, let me take this off of you now. Perfect, 120/60. Okay, so I'm going to bring all this information that we collected to the doctor. Like I said, the anesthesiologist will be in. Just ask you a few more questions to get you all prepped for surgery. Do you want that injection? Okay. Okay, then this will be the last thing that we do. Yeah, so whichever arm you want, I'm just going to open my needle up. So I'm just going to be taking a little bit of the medication and injecting it into your arm. You'll start to feel a bit sleepy, a little drowsy, and just, more calm overall. Yes, and this is midazolam, and this is a common medication given to calm the nerves and just make you feel less nervous for the procedure, okay? Yeah, midazolam. Okay, I'm just going to use a little antiseptic wipe to cleanse the area that we'll be injecting. So let me just see, which arm do you want to do? Okay, so there we go. And then I'm just going to be taking the vial here and just be taking a little bit. Okay. Let me just see your arm and just look the other way, okay? All done. Yeah. Now I know no one likes the sight of a needle coming at them, but you're all ready for surgery. Well, not for surgery, but that's all done. It should be kicking in within a few minutes. So I'm going to go get the anesthesiologist and give all this information that I collected from you to the doctor, and we'll be getting ready to get things going just a little bit, okay? Okay. Again, don't worry, I'm going to be in the surgery room during the procedure, and you really are in the best hands, okay? Okay, just try to relax. There's a TV over there if you want to watch something. Try to get your mind off everything before we get started. Okay, is there anything else I can help you with? Okay, the anesthesiologist will be in shortly.